for our daily update on the coronavirus outbreak and what the government of Nigeria and the citizens need to do to stay safe. We're now being joined from our Abuja studio by Professor Onyebuchi Chukwu, a former Nigerian Minister of Health. Professor Chukwu, good morning and welcome to the morning show.
Good morning, sir.
Good morning,
Good
sir.
morning.
Yeah, good morning, Doc, and the rest of the team. Good morning.
Good morning. Thank you for agreeing to come to the morning show. Well, we're discussing the coronavirus.
Thank you. Always a pleasure.
Yes, and you as Minister under the Jonathan administration in 2014 had to manage the crisis of Ebola virus outbreak in Nigeria. And, that was quite a moment for Nigeria. Now, we are being told coronavirus is a global challenge, although some WHO officials still insist that it's not yet a pandemic yet. But from what we have seen, every country needs to be prepared, as the WHO itself has advised. Now, Nigeria has taken certain steps. What do you think of those steps that have been taken by Nigeria in terms of sensitizing the public, setting up quarantine units in the FCT and 7 other states of the country, and in terms of the response from both the Nigerian Center for Disease Control and also the Federal Ministry of Health?
Thank you very much. I think, as announced by the Minister of Health, what Nigeria has done so far is very commendable. We've had lessons to draw from, so we should be much better prepared. What I haven't really heard yet is about the isolation facilities. If we had an outbreak now, do we have places to keep them? Yes, Lagos State feels, because many people come into the country through Lagos by air and by sea, probably by road, that they will probably be the most at risk. But it doesn't happen that way. Ideally, every state in Nigeria should be very prepared. Every state ought to by now have designated centers where suspected cases or established cases could be managed. I haven't had that yet. It's something I thought after the Ebola virus outbreak in Nigeria, we shouldn't be discussing again, because before I left office, we had already started making the procurement actually for some of these isolation centers. But the way I left office, I had to resign for some other reason. And
resigned to go and
not
be
so
governor.
happy that those. Well, that's what it was. But truly, I wasn't happy that some of those plans were not taken to conclusion. They were aborted somewhat when I left office. So I'm not too sure now we still can boast of proper isolation wards anywhere in Nigeria. So I'm not too sure, but maybe we'll ask questions. So that's one area I think we need to. Then about our land borders. When Ebola was already in West Africa, we just presumed that likely the case will come by road. But what happened? It surprised us still, even though we claimed to have been ready, it came by air. So now we're assuming it must come by air. Who said so? So again, in public health security, just like the rest of security, there's no room for presumptions, there's no room for assumptions. Sea, land, air borders must have the same level of preparedness. I'm not too sure we're up to that. Someone who has been in that office, I can tell you the land borders are a problem. Even those that are known to government, I don't think we've done enough. We used the opportunity of the Ebola virus to try and revamp the border controls there, but I'm not too sure. I think once the WHO gave us the certificate that we're Ebola virus disease-free, we let down our gas once again. So commendable so far, but I think it's not yet complete.
Thank you, sir, especially because WHO has identified Nigeria as one of the key countries that has a high volume of travel with China. What are your thoughts on those aborted plans that you referred to? Which one of them would you like to see as a matter of urgency being implemented now? What are the measures that need to be taken precisely?
We need to now have isolation centers that will not be abandoned in between disease outbreaks. Prevention of public health diseases is actually like taking an insurance. It's like taking an insurance. It is like the way you should run the accident and emergency center. When I was chief medical director of a teaching in a university teaching hospital, I used to be hurt by some of the things the nursing services department was doing. If 2 or 3 days we do not have enough casualties in the accident and emergency, they withdraw nurses. And I said, no, they are like insurance. It doesn't matter. 360 days in a year, they may not have a single case reporting there. But what happens the next day, after 360 days, you now have a mass casualty. So the people working there are being paid for the time and skills apprehended there. So also is preparation for public health emergencies like coronavirus outbreak now. You need to have such centers. It doesn't matter whether since 2014 we've not had to admit anybody. But now that we had an outbreak somewhere in the world, all you needed to do was clean the windows. The centers are there. The place has been maintained in terms of equipment. The reserve staff are ready. They should be moved in there immediately. And we should just be there waiting. It's not when it happens that we start running around to have governments, including state governments, build isolation centers. The other one is, I'm happy to note that we now have the capacity to make the diagnosis. But we could still do more by expanding the number of centers that will be capable of making diagnosis. Happily enough, the US CDC recently reported that they've even developed a test kit that can be used by ordinary health facilities. That is what Nigeria should go for. That is what in this bi-national commission meeting that just ended, we should have asked for. We should ask for those kind of kits so that virtually in every state, you have at least one center that is capable of making the diagnosis of coronavirus outbreak. So these two, then we should begin to run simulation. Those are important. If you have to fight fire, you need to always be prepared. It's easier said than done. From my experience, until you get into the field, it's more difficult. And you can see these kind of outbreaks are very frightening to people. You need by now to have selected the right kind of personnel. We're better off now. The Nigeria Center for Disease Control, which the Jonathan administration established, is now better established now. So that should be a lot easier now than what we had during the Ebola crisis in terms of recruiting people. It's not easy. Spouses, family members, friends were advised against workers going to volunteer for such services. So we need to get ready.
Thank you, Professor Chukwu. And definitely prevention is always better than cure. And when we speak about health, it's always more serious because, especially in developing societies, you're always going to have institutional voids. But at the end of the day, in the health sector, institutional voids are a matter of life and death. And right now, we're in a situation where this crisis is facing us. And quite frankly, we don't seem that prepared. A lot of people got anxious last week when the Commissioner for Health in Lagos spoke about self-isolation because many people believe that that does not necessarily lead to people actually isolating. And these are the kind of institutional voids that are going to affect us if, God forbid, an outbreak were to happen. However, we've had doctors like Dr. Cole come on the show this week and say, quote unquote, it's already here. In other words, we're just waiting for a case to prop up. Would you agree with that, or would you say that no, it's not already here? And maybe this is being said because we followed the WHO guidelines, but do the WHO guidelines really apply to a country with so many institutional voids in the health sector? Should we have really taken the bull by the horn right from the very beginning? Because right now, it may seem to a lot of people like we're looking for something that we're just looking for the news to prop up, in other words. What's your take on that?
From what I know, I think our surveillance system is one of the best in the world. But the angle I'm coming from is, what do we do when we have a suspected case? That is where I think the gap is. What do we do when we have a suspected case. But in terms of surveillance, I think we have one of the best surveillance systems, public health surveillance systems in the world. I'm not too bothered about that, but I'm not too happy that we must have gotten everything right when we have detected a suspected case. So well, that's the way I'll look at it. I think the Lagos state government is doing a lot. I commend that government doing a lot to create that awareness. That is the way every government, it shouldn't only be Lagos state. That's the way every government. I want to hear states like Rivers State make pronouncements, do preparations like Lagos State. I like to hear states like Zamfara. These are areas where we have had a lot of Chinese who probably might even be undocumented because of the gold mining there. States like Kano. And then states, in the war zones, northeast part of Nigeria, because there, for obvious reasons, the system is not as strong as in the rest of the country because of the ongoing war over there, the war against insurgency. There's no doubt that war against insurgency always affects public health, disease control. Afghanistan with polio is an example. The Democratic Republic of Congo with the still ongoing Ebola virus disease outbreak there is another example. And so those areas must necessarily, we must devote special attention to them. But overall, I think in terms of surveillance, we could still improve. No country has all it takes to do full surveillance, not even the United States, but we can rate countries, and I think Nigeria should be one of the countries in the world that have very good surveillance as of
well, Professor Chukwu, just before we go, we have just about 1 minute left. I'd like to ask you, should Nigeria evacuate the Nigerians, 60 of them, that are in the affected, ground zero in China? What we hear is that nobody out of the 60 Nigerians there has made any request to be evacuated. Should the Nigerian government just wait for a request before it takes steps?
Nigeria should not go to evacuate. But if any Nigerian wants to come back, he should not be prevented from coming back.
Well, thank you very much.
I mean, what is the objective of evacuating?
Well, thank you very much, Professor Chukwu.
Thank you
for being part of our daily update on coronavirus.